Hi, my name is Brandon Roth and I'm a student nurse with Miles City College. Today we're going to be demonstrating a intramuscular injection in the vastus lateralis. We are going to be injecting Rocephin, and first of all we are going to discuss the 6 rights of administering medication. We're going to start out with the right patient, the right medication, the right dose, the right route, the right time, and the right documentation, which will be done at the end of this injection. We have our physician's order. For Rocephin, 1 gram intramuscularly. We're going to do this with the Z-Track method. We also have our MARS record, our medication administration record, and we know that our patient is Skip Rocker. We are going to begin by taking a 6 milliliter syringe and applying a 22 gauge needle. We have our medication, and we have our, this is our solute, and this is our solvent. This is our solvent. We know that we're going to remove, or that we are going to need 5.6. So we are going to inject our needle to get air in our medication bottle, and we're going to draw 5.6. There we go. We are now going to inject the air in here. I will have already, I skipped this, but in order to do it properly, I would have wiped off both bottles. So now I'm going to inject my air. In here. I'm now going to turn it up to a 90-degree angle, and I am going to pull out 5.6. Make sure our bubbles are all out. I am going to re-wipe my medication top, and I'm going to inject. I will now reconstitute the medication without shaking it. I want to make sure that all particles of it are completely dissolved. I am now going to get my syringe and another 22 gauge needle. I'm going to take another alcohol swab and wipe the top of the medication. The reason I'm using another needle is because the first needle has been injected so many times that it dulls it. We're now going to take out 2 milliliters. Gotta make sure we have our bubbles of air are out. And I'm going to recap this using the one-hand method. Earlier, I did not properly take care of this. I should have taken it and put it into the sharps container, so I want to back up for that. We are now going to go down to our patient's room. I'm going to knock on the door. I'm going to address our patient, Skip Rocker. I'm going to tell him that I am a student nurse and that I will be administering his injection today. I am going to wash my hands and put gloves on. We are going to have the patient sitting up on the side of his bed. We're going to locate the vastus lateralis on his side here. Now that I have the site, we are going to clean the area with an alcohol swab. We're going to start in the center and work our way out. Now this is a Z-track injection, so I am now going to uncap the needle, or the syringe and the needle, and I am going to pull back on the injection site. I'm going to dart in. I'm going to aspirate while still pulling back, making sure that there is no blood. We are good. Now I'm going to slowly inject. At the same time, I'm going to pull the needle out and let go of the skin, and that will cause the Z-track. I am now going to place the syringe and needle in the sharps container, and I am going to document that this was done and the time. And now we're complete.